National leaders from Louisiana are pushing for a major change in Medicare. It would allow certain patients at high risk of developing colon cancer to get colon screenings every 5 years rather than 10 as preventative care. The push to pass the early detection screening legislation falls under President Biden's Moonshot Initiative.
Folks, it's fair to say one of the most devastating words anyone can hear, and it's not hyperbole, is cancer.
Legislators have already been effective in removing what's considered surprise billing. That's when patients pay out of pocket if polyps are removed during a routine screening. Dr. James Hobley is on the board of trustees for the American College of Gastroenterology. He says the next big hurdle for Medicare insurance is to also cover follow-up colonoscopies for patients who had polyps.
And so the problem is if you've had a polyp, you're high risk. If we wait 10 years, there's a high likelihood that you'll develop more polyps and maybe even a cancer in that interval time. So what we're working on now with Medicare and CMS is trying to work on them saying, hey, let's get rid of that language that prevents people from getting access to the very care they need based on a technicality.
Dr. Hobley says that if Medicare approves early screenings for high-risk patients, then other insurance providers will follow. The most vulnerable groups for colon cancer are those of low income, African American, or from rural communities.
You got people out there who are deciding between colonoscopy mortgage, colonoscopy car payment, colonoscopy kid in school. You fill in the blank. It's a way that we're trying to hopefully help get that eliminated so that we can keep people in the right place of healthcare.
And colon cancer is one of the top 5 most diagnosed cancers in Louisiana. In April, Congressman Troy Carter was in Shreveport to promote the importance of colon cancer screenings among African American men.